gastric acid, very acidic. And remember the little refresher, or let's ask the chat. I need a little break in speaking too. So what can result if gastric acid attacks the lining of your GI tract? Like say you don't have mucus there, say you don't have bicarbonate. What 5-letter word can result if gastric acid starts to dissolve the lining of your GI tract? Yeah, looks like most of you remember it. Yes, so glad to hear that. Yeah, so gastric acid, this is why the mucus is very important. It not only does a physical barrier, but it also forms a chemical barrier if you secrete bicarbonate in there as well. So the thing is that mucus cells also secrete bicarbonate, so you have a physical and chemical barrier against gastric acid. And if you don't have that, that can result in ulcers. So again, the bicarbonate system, buffer system, by reacting bicarbonate with protons, you can neutralize acid and form relatively inert CO2 and water. All right, so now that's what we have here. Now what we have here is, okay, we already covered this. Okay, so what can happen if gastric acid attacks and dissolves the lining of your GI tract? You can get a wound we call an ulcer. So we did cover peptic stomach ulcers briefly, and what happens is the gastric acid is eating away at the stomach lining. But notice downstream here, this can also happen down at the duodenum. And that makes sense because again, that acidic chyme this is the first stop when it exits the stomach. Now, we did talk about how bacteria and stress can cause ulcers, but other things can cause ulcers as well. So drugs can also cause ulcers, and this isn't stress, but it is a chemical we often take. And NSAIDs we did cover briefly when we talked about immunology. So what are common NSAIDs? Well, these over-the-counter drugs such as aspirin, ibuprofen, and naproxen, all of these things we take to relieve inflammation, fever, pain, so we do take a lot of these anti-inflammatory drugs. Now, the thing is that NSAIDs have effects on your GI tract, and this is why they say like, okay, stop it if you feel pains or you're prone to ulcers, don't take these NSAIDs. Because why? Well, it deals with this type of chemical or this group of chemicals we call prostaglandins. And what prostaglandins, this isn't, your body naturally produces prostaglandins in response to inflammation. So it's the way your body kind of signals to the local area where inflammation is occurring. Hey, there's something that needs repair or something's wrong here. Let's cause inflammation. Let's bring the immune system into this. So prostaglandins also affect gastric mucus. So it's not just about immune system function. It also affects the production of gastric mucus. It's also going to inhibit the production of gastric acid. So basically, it kind of makes the conditions favorable toward repairing the lining of your stomach. Now, cyclooxygenase or COX enzymes, these are enzymes that make these prostaglandins. And how does this relate to things like aspirin, ibuprofen, naproxen, and these NSAIDs? Well, the thing is that NSAIDs are COX inhibitors. So by inhibiting COX, what happens is that NSAIDs decrease the amount of prostaglandins you produce. So by decreasing the amount of prostaglandins your body produces, well, that helps your inflammation, that helps your fever, that helps your pain and swelling. But the thing is that it's also going to decrease your gastric mucus, and it's also going to increase your gastric acid production. Now you have more acid and you have less of that protective mucus. What is that going to do to the lining of your stomach? So again, pretend we have our stomach here. So we have our NSAID over here, and what's that going to do? That's going to inhibit that cyclooxygenase enzyme. So it's going to decrease the activity of cyclooxygenase, thereby decreasing prostaglandin production. Remember, prostaglandin makes gastric acid more basic and also increases mucus production. But now you're kind of flipping it the other way around. So by decreasing prostaglandins, you're going to have less mucus and you're going to have more acid. So this is why if you take too many of these NSAIDs, they can cause ulcers. Why? you're thinning out the mucus layer, you're making your gastric acid more acidic. So this is why you're more prone to developing ulcers if you take too many of these NSAIDs. So how can you prevent? But it's okay. So how can you prevent peptic ulcers besides like not taking too many of these NSAIDs? Well, you also have Omeprazole or Prilosec is the trade name for one of the trade names. So what it does is treats peptic ulcers, and if you may have heard of a term called GERD, gastroesophageal reflux disease. And what it is a proton pump inhibitor. And we just talked about proton pumps. I know some people have difficulty with the cellular and molecular part of anatomy and physiology, but this is why it's very important to know that, because this, especially if you're going to pharmacology or medicine or nursing, that a lot of times our drugs target these small proteins and molecules found on our cells, and this is one example. So back to our parietal cell. So remember our parietal cell, it has what it does is uses the bicarbonate buffer system to generate a bunch of carbonic acid, and then you're going to generate a bunch of bicarbonate and protons. And hey, remember how those protons get from the inside of a parietal cell into the inside of the stomach? Yeah, they're going to use a proton pump. So the proton pump is able to move acid from the inside of a parietal cell to the gastric gland lumen. Now that's going to increase the acidity, but what if you're prone to peptic ulcers or GERD? Well, what you might take is that omeprazole that's going to block and inhibit this pump. So without this acid and protons being able to be pumped into the insides of your stomach, that's going to lower the pH of your gastric acid, thereby making it less likely that your gastric acid is going to chemically digest your lining of your stomach. So this is going to provide relief from the ulcers or help your ulcers heal by preventing the acid from exacerbating and worsening the ulcer. Yep, so by decreasing the acidity, by blocking this proton pump. All right, so then what else? So this is what it's kind of doing. Omeprazole, what's it going to do? It's going to decrease the acid production, thereby lowering the acidity of your gastric acid, thereby making it easier for your linings of your GI tract to heal and not be impeded by high proton concentrations and low pH.